Everyone, welcome to another episode of Conversations in Community. We are talking today about something that, quite frankly, is literally impacting everyone out there. There is no one who will watch or listen to this that has not been impacted by the coronavirus and COVID-19 in some way. So I thought it was appropriate, good idea to talk about this, especially now as we head into the cold and flu season. In fact, recently, you may have seen this, Dr. Michael Osterholm, world-renowned epidemiologist at the University of Minnesota, predicted on Meet the Press that the next several weeks of this would be what he called the darkest of the pandemic. That is not meant to scare you, that is meant to inform you. In fact, many infectious disease experts have long warned of a potential second wave. So that is why I enlisted the help of one of those experts, who happens to be one of my dearest friends, Dr. Becca Peglow, to help us understand all of this. She is an infectious disease doctor here in the Twin Cities who is on the front lines treating this virus. She and I have known each other probably since kindergarten. I trust her with my life. She, in fact, was an usher at my wedding, and I've never seen lines formed as efficiently as she and Stephanie Burns had them going. It was beautiful. Anyway, not only is she good at the ushering thing, but the doctor thing. So much so that the Minneapolis-St. Paul magazine recently called her a, quote, rising star in her field. So, to recap, this episode is about Becca's experiences. The next episode, she'll answer your questions. What's it like now, as far as the type of patients you're seeing?
Yeah, it's a good variety. I think things calmed down over the summer, and unfortunately we're starting to see a rise right now of cases. And it's a good mix of people that are on the floor, as we say, so like not in the intensive care unit and not requiring a ventilator or really high oxygen needs. And then we've had a big chunk of ICU admissions over the course of the last 3 weeks, which was kind of surprising because we've done a lot better with treating these patients over the last 3-4 months. And so these, the word we use is smolder, these kind of smoldering cases come in, and then we see this point usually at the onset of their symptoms, usually about day 8 to 10, we see them just rapidly change and require a lot of oxygen needs, and that's when we really support them in the hospital, and a lot of really sick people.
Just give me a sense of what you're seeing. Is it people recover? A lot of people recovering, some people not? What are you seeing?
Yeah, there's good and bad. I think that there's sort of pre-steroids and post-steroids is the way I like to look at the pandemic. So kind of pre the end of July and post the end of July, when we really got good data to use a different treatment called dexamethasone or a steroid to help people recover, and it's really had a big impact on that treatment. And we've seen a lot of people die, and it's hard to watch, and people are isolated and alone, and families and visitors are really limited of coming into the hospital, and it's hard to watch. Really trying to walk people through what's going to happen, and that's been really difficult. But there's also a lot of positive things I've seen, and family support and just overall community support for people that come in and rally around really sick people. And it's not everyone that is a super sad story or happy story. There's a lot of 5 to 7 days where they're in the hospital and really feel like they're really sick, and a quick turnaround and they're out of the hospital in a week. So it's just hard. And I think there's certain things that really hit you. And really early on, I had a really young patient, and that's what opened my eyes. I had a 30-year-old patient, and that really just was difficult to watch. And it really made me realize that I am no longer invincible, and kind of opened my eyes to my family and the risks that we're taking. And so it's not just the really old or the tiny, tiny babies. It's young people that are at risk too. There's been anyone from 20 to 101 where I've seen them, and we're involved in a lot of the cases at our hospital, but recently we see kind of family clusters, and it's hard to watch, a family or a daughter, for example, be admitted and her parents are up in the ICU, and you're managing the daughter or a brother or someone downstairs, and it's tough because the whole family is admitted to the hospital, and we're seeing a lot of these multi-generational families where people live together and sort of clusters. And as you've probably heard on the news and reports, but a lot of the underserved populations and people of color are really been affected, and that's often what we're seeing. Big chunks in clusters in our hospital in particular. I work at a hospital where there's a lot of non-English speaking patients and people of color, and it's been tough to see whole families admitted to the hospital.
The unknown that's what seems to be, I think, for a lot of people, just a little unnerving. It's
unnerving, I think, for everyone, and this was the weirdest and most difficult thing I've had to face, and I'm not, an elder physician by any means, but it was shocking. I was a resident or an intern during the H1N1. And so this was eye-opening and really shocking. And it's hard to anticipate and know who will really get sick. And the best thing that the community and people with high risk, like maybe asthma or obesity or diabetes, or even just no risk factors, maybe someone at home that you live with has risk factors, is just to try to decrease your risk and decrease the amount that you're going out, and wear a mask and really listen to the public health officials. And social distancing does work, or physical distancing is a better way of phrasing it. And, really trying to mitigate or decrease your risks the best that you can, so that you can not end up in the hospital, or at least not end up sick and potentially spreading it to someone else.
You mentioned H1N1. How does this compare, this virus, to that or anything else you've witnessed or studied?
Yeah, I mean, compared to H1N1, it's totally on another level. MERS, the Middle Eastern Respiratory Syndrome, similar to, this coronavirus, I watched as a fellow when I was a fellow in infectious disease training, and it really opened my eyes to what's going to happen. And we knew that a pandemic would come, and everyone always asks infectious disease doctors, what's your biggest fear? And it was always a bad influenza shift, or a really bad coronavirus or respiratory virus pandemic. And we knew it was coming, but this is a lot different than what we would anticipate. It's just unpredictable, and we just don't know enough.
How have you seen it as far as the treatments and everything? What have you learned, and how has it gotten better?
It's fascinating to watch, and the medical community came together really quickly, worldwide, and I mean, they sequenced the virus within a couple weeks in China. I mean, we knew what we were dealing with. We had a test really early on, and the rapid pace of medical technology was just really fascinating. Were there faults? Absolutely. And can we do better? Yeah. But it's amazing watching the medical community come together. That part is positive. And we've come leaps and bounds. We have antiviral medicines that have been developed, and we've started to use anti-inflammatory medicines like steroids, and they're working on other modalities to decrease the inflammation, or, work on antibody response. So we've had just really fascinating and really quick research turnaround. So that you're watching the science process in action, and it's frustrating a lot of people, but it's amazing to watch people really develop new things, test them, hypothesize, and improve or disprove things as the community and as the public are watching.
Yeah, I mean, it's like that. I'm not a scientist, but I'm assuming that's how science works. I mean, things do change over time. You learn and you change course.
Yeah. We took science together. You know that.
Yeah, it wasn't as intense as this. In fact, I remember making maybe ice cream once.
We did in physics class.
My ice cream was killer, by the way. It was very tasty. So in that regard, I'm probably close to your ability as an infectious disease doctor.
You're up there. You're up there.
I'm surprised I haven't been published yet, or what I've done.
Well, can I just say one thing? I mean,
Yeah,
and
please.
this has been bugging me like since the beginning, and this is, I'm not a public health expert by any means. I mean, I'm an infectious disease doctor and we learn a lot about it, don't get me wrong, but the public health officials are amazing at what they do. And really they're sort of the scapegoat on a lot of this, and they sort of fall on the chopping block for a lot of the fault and other things. But they always say, and I think that the public really forgets this, but a really good public health initiative is one where you don't see the effects of a virus and you don't see this, the horrifying, backlash of what a virus or an infection can do, because the public health measures have really mitigated that and stopped it. And so usually it's invisible, and a lot of the stuff that they've done is not seen in the public or ignored. And so a good public health push is really what is happening kind of behind the scenes, and they've been incredible. And if we just listen and heed their warning and their suggestions, I think we can go a long way.
Next time on Conversations in Community.
What about Halloween coming up?
I think you have to approach it sort of on a risk basis too.